Everyone, I'm back with another 7 marker question from conservative dentistry, which is classify dental amalgam, write about its composition, and compare delayed versus mercuroscopic expansion. With the classification of dental amalgam alloys, there are several ways of classifying amalgam alloys. These include according to the number of alloyed metals. They can be binary alloys which contain silver and tin, ternary alloys which contain silver, tin and copper, quaternary alloys which contain silver, tin, copper and zinc or indium. According to the shape of the particles, they can be irregular, in which alloy particles are irregular in shape in the form of spindles or shavings. They're also called lathe-cut alloys. Then spherical, in which the alloy particles have a smooth spherical shape. And spheroidal, in which the alloy particles are spherical with irregular surfaces. According to the copper content of the alloy, they can be low copper alloys which contain copper in the range of 2 to 6%. They are also called conventional alloys. And high copper alloys which contain copper in the range of 12 to 30%. They are of superior quality. According to zinc content, zinc containing alloys contain zinc in the range of 0.01% to 1%, and zinc-free alloys which contain less than 0.01% zinc. According to whether the alloy is unmixed or admixed, they can be single composition or unicompositional alloys in which each particle of the alloy has the same chemical composition, and admixed alloys. These alloys are a physical blend of lathe-cut and spherical particles. Presence of noble metals. They can be noble metal alloys which contain small amounts of palladium or gold, and non-noble metal alloys which do not contain any noble metals. Based on size of alloy powder particle, they can be microcut or macrocut. Of the dental amalgam, it is to be remembered just as it is. So I'll read out for you. Low copper alloys contain silver in the range of 63 to 70%, tin in the range of 26 to 29%, copper in the range of 2 to 5%, and zinc in the range of 0 to 2%. The lathe cut two-thirds of the admixed high copper alloys contain silver in the range of 40 to 70%, tin in the range of 26 to 30%, which is similar to the low copper one, copper in the range of 2 to 30%, and zinc is also similar with the low copper ones. Then spherical one-third of the admixed high copper alloys contain silver in the range of 40 to 65%, tin in the range of 0 to 30%, copper in the range of 20 to 40%, and they are zinc free. Then unicompositional contains silver in the range of 40 to 60%, tin in the range of 20 to 30%, copper in the range of 13 to 30%, and zinc in the range of 0 to 40%. The composition of dental amalgam is incomplete without writing the function of each constituent. So, first constituent is silver. It is considered the major element. Its function is to whiten the alloy, decrease creep, increase strength. It also increases the setting expansion and decreases tarnish. Second component is tin. It regulates reaction between silver and mercury. It also controls the reaction, slows setting reaction, and reduces setting expansion. However, the disadvantage of tin is that it also decreases strength, decreases hardness, and increases tarnish and corrosion. Therefore, the amount used should be limited. Next, copper. It increases strength, increases hardness, increases setting expansion. Zinc. It is also considered the scavenger or deoxidizer as it prevents oxidation of silver, tin and copper. Then mercury 3% can be used for pre-amalgamation. It helps in rapid reaction between the mercury and the alloy particles. Next, platinum. It increases hardness and decreases corrosion. And palladium. It increases hardness and whitens the alloy. Last is the indium. It reduces mercury vapor and improves wetting when added to mercury. It also reduces early strength but increases the final strength when added to the powder. Between delayed versus mercuroscopic expansion. So delayed expansion. It is caused due to effect of moisture contamination. If a zinc containing low copper or high copper amalgam is contaminated by moisture during trituration or condensation, a large expansion can take place. It usually starts after 3 to 5 days and may continue for months, reaching values greater than 400 micrometers. This is known as delayed expansion or secondary expansion. The expansion is caused by the releases of hydrogen gas from the reaction of zinc with water. This hydrogen gas does not combine with the amalgam, but collects within the restoration, creating extreme internal pressure and expansion of the mass. This causes protrusion of the restoration out of the cavity, increased creep, increased micro-leakage, pitted surfaces, and corrosion. Dental pain, recurrence of caries, and fracture of the restoration are seen as a result of these poorly inserted restorations. Moisture contamination after the cavity has been filled does not cause delayed expansion. Non-zinc alloys do not show this type of expansion when contaminated with water. However, moisture contamination of the mix of any alloy results in inferior physical properties. Now, mercuroscopic expansion. During electrochemical corrosion of low copper amalgams, the tin mercury phase oxidizes into tin oxide or tin oxychloride. Electrochemical corrosion of the gamma 2 phase does not appear to release mercury into the oral environment. Rather, the mercury immediately reacts with the locally available silver and tin from residual amalgam alloy particles and is reconsumed to form more reaction products. This produces further expansion of the amalgam. This mechanism was explained as mercuroscopic expansion by Jorgensen and is seen only in low copper amalgam. This is responsible for extrusion of amalgam at the margins followed by marginal fracture or ditching. That's it. If you like this video, please subscribe to my YouTube channel. Thank you and stay tuned for further videos.